Hello and welcome to my channel. The content in this video is not intended to substitute professional medical advice. Please seek advice from your qualified healthcare provider if you have any questions about COVID-19 or the vaccine. This is a non-sponsored COVID-19 vaccine documentary that took place over December and January. Thank you for listening to our vaccine experiences. We hope this is helpful. My name is Lizzie, and I am a resident physician in medicine pediatrics in the DC area. I was afforded the privilege of receiving the 2-shot series of the Pfizer COVID-19 vaccine, and I am now fully immunized. I started this documentary due to my own history of allergies and anaphylaxis, then I felt that others would benefit hearing about our experiences and stories. I've asked that my friends and colleagues send me video clips about their experience for both Moderna and Pfizer. I can assure you no shortcuts were taken in generating these vaccines, and they are 95% effective when you receive both doses. They both use mRNA technology, which means that they use your cell's protein machinery to generate the S protein, or spike protein, found on the outside of COVID-19. They do not enter the nucleus of your cell, and it does not get incorporated into your DNA. Once you generate the spike protein, you're able to mount an immune response to generate immunoglobulins, memory T and B cells, so that when you encounter COVID-19 in real life, you're able to mount that response and protect yourself. Now I would like to speak about my own vaccine experience. Keep in mind that side effects are part of a healthy immune response, and they are expected. Some people don't get side effects, and that's okay too. For me, for the first vaccine, which was about 5 weeks ago, I had fatigue and arm soreness for 3 days. Initially, I did have dizziness and a headache with that vaccine as well. Everything resolved after a few days, and I was back to normal. My second dose, which was about 2 weeks ago at this time, I had more significant side effects. Immediately after the injection, I did experience dizziness. I also had nausea, my heart rate increased, and I had a headache for the first 12 hours. At about 12 hours, I started to experience muscle aches, sweats, and I broke into a fever, which increased to about 101 at its peak. I had significant nausea and a headache as well. This lasted about 36 hours and then resolved, and I was completely back to normal at about 48 hours. Would I do this again? 100%. More than 400,000 people have died from COVID-19, and it's flipped our world upside down. Having these side effects for a few days just lets me know that my immune system is healthy, and I am now protected against COVID-19.
Hi guys, my name is Pooja. I'm a physician. I got my Pfizer COVID vaccine back in December 17th last year, and I'm doing great. I did have a little bit of arm soreness after the vaccine, but that went away after like a day or two. And otherwise, no other reactions, and please go get your COVID shot.
Hi, I'm Dr. Elizabeth Salenti. I received the first dose of the Pfizer vaccine on December 23rd, my birthday. It was the best birthday present I've ever gotten. I had a sore arm for about 24 hours afterwards, but no other adverse effects, allergic reactions, or any other concerns, and I feel great, and I'm looking forward to getting my second dose in another week.
Hi, my name is Travis. I'm one of the medicine chiefs at Georgetown. I received my vaccine about a week ago. I had a little bit of soreness in the arm, a little bit of aches and pains, but it went away. And you can trust me, the vaccine is better because I had COVID, and if I had to choose between COVID or the vaccine, I'd choose the vaccine.
Hi, my name's LaShawna Ferguson. I work here at MedStar Georgetown University Hospital as the Patient Services Supervisor. I received my first dose of the Pfizer COVID-19 vaccination on December 16th. I had no reactions at all, just a very sore arm a day or so afterwards. And I'm scheduled to receive my second dose tomorrow, so I'll let you know how it goes.
Hi, my name is Joby. I'm one of the 4th-year MedPeds residents here at Georgetown. I got my first COVID vaccine 3 weeks ago, and I just got my second dose today. I didn't really have any side effects. With both shots, I had and have a little bit of arm soreness, just like with the flu vaccine, but other than that, it was pretty smooth sailing. So hopefully I'll keep feeling well for the rest of today and the next couple of days, and then in 7 days I'll be fully vaccinated and protected.
I'm Kelly, I'm a physical therapist at Georgetown. I got my first COVID vaccine about 2.5 weeks ago, and I got my second one on Sunday. Overall, I'm feeling great, just a little bit of soreness in my arm, and a little bit of aches, but Tylenol helped. Everything else went away, and now I'm feeling great.
Hi, my name is Dr. Daud. I'm a resident here at San Joaquin General Hospital. Today I got the second dose of my Pfizer vaccine. I just got a little sore after the injection, but otherwise I've been feeling pretty good. And I feel hopeful.
Hey guys, my name is Amrita. I'm a third-year resident at a program in New Mexico. I got my COVID vaccine about 2 weeks ago now. I didn't feel it going in. I had a little bit of arm soreness that lasted a few hours, some fatigue that lasted maybe 2 days. But aside from that, that was it. I was a little hesitant going in, to be honest, as I am a transplant recipient, so I am immunocompromised. But 2 weeks into it, and I feel fantastic, and I'm very, very thankful to be a part of this.
Hi guys, my name is Michelle. I am a chief resident at a community hospital located in Florida, Southwest Florida to be exact. I got my COVID vaccine on 12/30/2020, and I had about 2 to 3 days of right arm tenderness, soreness actually, and that was it, no other symptoms. So I know that when it comes to underserved, underrepresented communities, there's a lot of distrust, but I can assure you that this COVID vaccine, I had no real serious side effects.
Hi, I'm Rachel. I'm a general surgeon in northern Michigan. I got the Pfizer vaccine. I got my first dose about 3 weeks ago, and I just got my second dose this morning. You can see here. After the first dose, I had no problems. I was feeling well. No fevers, nothing like that, and not even really any pain after the injection. You know, as far as why I got this, I got married about a year ago, and I have been very afraid since this whole thing started about bringing this virus home to my family. My parents are older, my husband's a little older than me, and the last thing I want to do in the midst of all of this, besides putting myself at risk, is put my family at risk and even the people in my community, those around me. So I'm very happy that I was able to get this. Very thankful for Pfizer and for all of the scientists involved, and for the politicians and the rest of our society that is completely in support of science and furthering our knowledge and keeping us safe.
Hi, my name is Ashley Olson. I'm an emergency medicine physician in Kansas City, Missouri, and I received my first dose of the COVID-19 vaccination from Pfizer on December 18th, and actually just got my second dose today, so fully vaccinated, very excited. So far so good, no side effects, but I'll keep you updated. Thanks.
Good morning, my name is Matt Nasri. I'm a PGY4 here at Georgetown. I have no allergies to foods or drugs, no previous allergies to vaccines, and I'm not immunocompromised. I got my first vaccine 3 weeks ago, and afterwards the only thing I had was arm soreness. And then I received my second vaccine of the Pfizer vaccine series about 3 days ago. And I actually felt very fatigued. I had myalgias diffusely, and then I also had axillary lymphadenopathy on the side that I had my vaccine. But thankfully that went away within 48 hours. And so now I'm really excited to get back out there in the world and maybe go to a few restaurants, and I think it will be fun.
Hi, I'm Ryan. I'm a third-year medical resident here at Georgetown. I got my first dose of the COVID vaccine about 3 weeks ago, and the second dose 2 days ago. I feel great now. I had a little bit of arm soreness after my second dose and felt just a touch run down, but I was able to bounce back, and I feel pretty good today. This is Marina.
Hi, I'm Marina. I'm an intern here. I also got my COVID vaccine 3 weeks ago on the first dose, and then I got the second dose yesterday. I responded great. I didn't have a fever, no pain, just a little soreness in the arm as well. Otherwise, doing great.
My name's Sarah. I'm an internal medicine resident here in New Mexico, and I got the first dose of the COVID vaccine on December 18th. I had some soreness in my arm for a day and a half, and on days 2 and 3 I was a little bit fatigued, but otherwise no significant symptoms related to the vaccine, and I feel totally normal, fine now. I'm actually headed in for my second dose right now, and we'll see how this goes. But I am excited for just the hope that this brings, because this year has been really challenging for us in the medical profession. All right, wish me luck.
Hi everyone, my name is Maheen. I am a PGY3 at Baylor College of Medicine. I'm a physical medicine and rehab resident. I'm so excited to be part of this. I wanted to just share my story. I got my first dose of the COVID-19 vaccine on December 16th, 2020. Just a little bit of muscle soreness after that one, no big deal. I got my second dose just this past Wednesday, January 6th, 2021. Just did really well after it. The second day I had a low-grade temperature and some muscle rigors, but other than that, did totally fine. Nothing that a little nap and some Tylenol couldn't fix. Felt really great the day after, and I'm feeling good. I'm super excited to see what happens next.
Hi, I'm Tracy. I'm an internal medicine resident. I got my first COVID vaccine about 3 weeks ago. I felt a little bit tired for maybe 24 hours and then was fine. And I got my second vaccine 5 days ago now. I had some local redness and swelling, and I have a little bit of residual redness, but it's not painful anymore, not itchy, and it's started to go away. I am very excited to be vaccinated now, and I'm looking forward to being able to see my dad again, who we've been quarantining from to stay safe.
Hey, my name is Rachel Kim. I'm a psychiatry resident in Kansas City. I received my COVID vaccine from Moderna, the first shot, on January 8th, so about 3 days ago, on my left shoulder. And initially I had some soreness, but so far no side effect other than that, and I've been doing great. The soreness went away in 24 hours, honestly, and I'm signed up to receive my next injection on February 6th. All right, thank you.
Hi, I'm Nicole. I am a PGY2 in family medicine in the Grand Rapids and the West Michigan area. I have received my 2 doses of the Pfizer vaccine in the fight to protect our friends, family, and our communities against COVID-19. I received my vaccine around 9 a.m. on Saturday morning. It is now about 6 p.m. on Monday evening. Many of my colleagues did have some of the normal body immune response to a vaccine, which is good to know. I was able to take Tylenol and ibuprofen and made sure I took that scheduled just to prevent any symptoms. And I ended up having no symptoms other than a little bit of a sore arm. And actually my arm was more sore after the first vaccine. So I am so grateful to have the opportunity to be able to be a part of such a unique piece of medicine. And I think just like Alexander Hamilton says, as many of us hopefully maybe have seen during quarantine, this is our shot. This is our shot to make a difference and to be part of something new and exciting. And vaccines have been around for so long and have been saving us from things like polio and smallpox and meningitis and working on those things. And I think that hopefully in the near future, we'll be able to say it did the same from COVID-19. Best of luck to everyone, and I'm hopeful that we can continue to grow in medicine and start to be able to see our friends and family and colleagues in person again.
Hi, my name is Elle. I'm a resident here at Georgetown University's Medicine Pediatric program. I got my vaccine about 3 weeks ago and then again on Friday, so about 4 days ago. So the first vaccine felt like somebody punched my arm a bit hard for maybe like 6 hours, about half a day after I got it. The second vaccine kicked my butt a little bit. It felt like a flu. I was tired and cranky, and again, my arm really hurt, but I was able to go outside, walk, run, force myself through my normal life. Felt better the next morning. So the things that I'm looking forward to the most now that I have my vaccine is not infecting my fiance, so that's kind of cool, and also going to the gym possibly one day. Pretty out of shape.
Hi, my name is Ann. I was lucky enough to get the Pfizer vaccine for COVID-19 the first day it came out to California, I think. I was very happy to get it. I did not get any reaction after my first shot at all. And then 3 weeks later, I got my second shot. And I did have I think the day of my second shot, I had some fatigue, like tiredness, just like feeling sleepy. Maybe I was just sleep deprived. But the second day, the following day, I did have some body aches and perceived, but not confirmed, mild fever. But that lasted just that day, and then I felt completely normal the day after. So, you know, and then I guess they said that it's kind of expected, or it is within normal expectation to have a little bit of a response or reaction after the second shot, because it is a booster shot. But the reaction was really mild, and it was very brief. And I'm very happy. I feel very well now. It's been 7-8 days after my second shot, and I feel very healthy.
Hi, my name's Krista. I'm an interventional radiology nurse at a comprehensive stroke center and level 1 trauma center in Alabama. I had the opportunity to receive the Pfizer COVID-19 vaccine on December 16th, and with the first dose I just had some mild arm pain on day 1, and then day 2 I had some more moderate arm pain. It was bad enough that I took some Tylenol for it, and then by day 3 the pain was almost entirely gone. And then I received the second dose on January 6th, and with that dose I had a little more severe symptoms, but nothing really serious. That night I developed some chills and was just kind of hot and cold all night and had some trouble sleeping. And then next day I had a mild headache and some mild muscle aches and fatigue that lasted throughout the day, as well as the hot and cold. But by that evening I felt pretty much back to normal, slept fine that night, and I went back to work the next day and felt just fine. One thing that my hospital recommended was to take the dose when you didn't have to work for the next day or two, and that's what I did. I took it before my off day, and I'm glad that I did that because I was able to just rest on the day when I was feeling the worst. So based on what I've seen with COVID patients and just a lot of stories that I've heard and people that I've known that have had it, I would say that the symptoms that I experienced were much better than actually having COVID, and so I would definitely do it again, and I highly recommend.
Hello, my name's Natalie. I am a COM 2017 grad. I'm a family medicine OB fellow in Kansas City, and I am 2 days out from finishing my Pfizer COVID vaccine series. I did great after the first shot. After the second shot, I definitely had some fevers, chills, body aches, but that's all resolved and I feel back to normal. And I'm really grateful to know that my body is doing what it should, and I feel a great deal of relief knowing that I am better protected against COVID. So this is our shot, and couldn't be happier to have gotten it.
Hi, my name is Johanna. I'm a staff gastroenterologist and I practice in San Antonio, Texas. I initially got my first COVID vaccine Friday, December 18th. When I first got it, I had a little bit of a sore arm, which lasted for about 2 days, nothing I couldn't handle. Still was able to do procedures. And then I had my second dose Friday, January 8th. That I didn't have any sore arm. I did wake up Friday evening around midnight with a temperature of 99.4 and some chills. Took some ibuprofen and fell right back asleep. I was hesitant at first to get it. I didn't know. My husband and I are trying to get pregnant, and we're actually going through infertility treatments, and I reached out to my infertility doctor to see if he would recommend it, and he did recommend it, as well as American College of Obstetrics and Gynecology, so I decided to get it. I have no regrets, and if I had the option to do it all over again, I would definitely do it. Thanks for letting me be a part of this.
Hi everyone, my name is Christine. I am an intern at Georgetown. I got my first COVID vaccine 3 weeks ago, and I had almost no symptoms at all. I was a little tired after I got it and took a nap when I got home,
but that was it. I didn't even have any arm soreness or anything. I just got my second dose about 4 hours ago, and so far doing great. I've heard from friends I might need to anticipate that changing and maybe a few more side effects on this go-arounds, but I'm ready for them, I'm prepared. Would much rather have a few side effects for a day than have to deal with COVID for weeks on end. So really excited to finally have my second dose. The thing I'm most excited for is for all my friends and family to get vaccinated as well, and hopefully we can all just get back to life as it used to be.
Hi, my name's Erica. I'm an internal medicine resident at the University of New Mexico. I received my first dose of Pfizer's COVID-19 vaccine on December 28th, so I'm a little over 2 weeks out at this point. The only side effect I really had of the vaccine was a pretty sore left arm, but that did resolve quickly after 24 hours. And then other than that, I really haven't had any symptoms. Initially, I was actually pretty skeptical of the vaccine. However, just after looking at more data and seeing even more people that came through the hospital, I went ahead and decided to get the vaccine. And at this point, I would urge people, whenever it is available to the public, to please go get the vaccine so we can start moving forward.
Hi, I'm Grace. I'm an internal medicine resident in Albuquerque. I got my Pfizer COVID vaccine, the first part on December 21st and the second vaccine on January 11th. After I got the first one, I had some arm soreness, and after the second one, I experienced some nausea, headache, and chills. All of those side effects went away after about 24 hours. And I feel back to normal today. And I would recommend we all get the vaccine so that we develop herd immunity and we protect those who are most at risk.
Hi, I'm Charles. I am a third-year resident in internal medicine pediatrics at Georgetown University. I also have type 1 diabetes and I have Crohn's disease. I am immune suppressed because I do take Humira every 2 weeks. I actually started Humira in the middle of this pandemic. I wanted to give you some of my thoughts and experiences on my what I dealt with when I took the COVID vaccine. So I got the first COVID vaccine on December, I believe it was December 18th or sometime in mid-late December. And it hurt. It hurt for a couple of days, but I didn't really get any other symptoms. I felt fine otherwise. Then I got my second dose in early January, about a week ago now, I guess. And I did have some side effects with that one, some sort of expected effects, really. I had a little bit of headache, some body aches. I felt a little bit worn down. I felt a little bit like I just had like a virus, but only for about a few hours. I felt fine. I got it at noon, and then the following morning I woke up with those symptoms. I took some Tylenol, I took some Advil, and went back to sleep, drank some water, and then within a few hours after waking up, I felt back to normal. You know, considering what I've seen COVID do to people who are immune suppressed and people who are not immune suppressed, I would rather take, you know, a few hours of feeling a little bit crummy to being in, you know, the intensive care unit on a ventilator. It's definitely worth it. I am so glad and grateful that we have this vaccine, and I really encourage you all to sort of avoid misinformation and understand that this is a public health crisis, and the only way to solve it is to get herd immunity, and the only way to get herd immunity is for everyone to get vaccinated.
Hi there, my name is Caitlin Whitler. I'm an internal medicine pediatrics PGY4 at the University of Missouri, Kansas City. I got my first dose of the COVID vaccine when I was about 14 weeks pregnant. I got my second dose recently and I'm about 18 weeks pregnant. I felt like it was the right decision for me. I had reviewed the ACOG recommendations. I spoke to my amazing OBGYN. I talked to some of my infectious disease mentors, including my dad. My baby is very healthy and I'm happy with the decision that I made, and I'm Looking forward to being a part of the research for pregnant women who are wanting to receive the vaccine in the future.
My name is Mitch. I'm a resident at San Joaquin General Hospital. I got the Pfizer vaccine, 2 doses. The last dose was about a week and a half ago, and the other dose was 2 weeks before that. The only side effect I had was some soreness at the site of injection that lasted for about a day or 2 and then went away and wasn't bad at all. And now I'm feeling great.
Hi everyone, my name is Shani. I'm a family medicine resident at San Joaquin General Hospital. I'm letting you know that I got both Pfizer vaccines, and I did get some muscle soreness and a little bit of chills about 24 hours later, but they went away, and now I'm feeling great. I don't feel sick at all. I never got fevers. I never had to be hospitalized, so I highly recommend it.
Hi, I'm Sarah. I'm one of the interns here at Georgetown. I just got my second dose of the Pfizer vaccine on Wednesday. It's now Friday. After the first dose, I felt great. I had a tiny bit of arm soreness, but it really wasn't that bad. No side effects whatsoever. After the second dose, I felt good for the first 12 hours, and then I did develop some pretty severe muscle aches and some fever, chills, kind of thing. So I would say I'm still not out of the woods with those symptoms, but I would do it again if it means having immunity.
Hey! So I'm here to tell you a little bit about my experience with the COVID vaccine. I got my first one, after which I didn't really have any side effects, a little bit of sore arm a day later, but nothing else. It went great. It was really exciting getting the first one. And then after 18 days, I got my second vaccine. The second one, for first 10 hours or so, it was fine. But after which I got fever, chills, a lot of myalgia, like body pain, so joint pain, muscle pain. And then I had night sweats for a couple of nights after. It did eventually subside, and by after 48 hours, I was a completely new person. The thing that I did to help through the symptoms was to take ibuprofen every 8 hours and Tylenol also, and that helped. So just a lot of resting, hydrating myself, and yeah, and now I'm fully immunized. Yay!
And this is Shruti, by the way, one of our residents here.
Yes.
Yeah.
Shruti.
Thanks.
Hey everybody, I got my first and second doses of the Pfizer vaccine. Super excited, didn't really have any issues. Really happy to be fully vaccinated.
Hi, I'm Oscar Liu. I'm a family medicine resident in the Kansas City area. I got both doses of my Pfizer COVID vaccine. With the first dose, I had a little bit of shoulder ache for about a day, and then with the second dose, had a little bit about the same, along with a day of fatigue and headache, which did go away. So I'm very excited about us marching forward back to the norm as a nation.
Hi, my name is Abu Bakr Sheikh. I'm one of the third-year resident here at University of New Mexico. I got my first dose of COVID-19 vaccine on 18th of December. I had sore arm and fatigue that lasted for about 24 hours. I got my second dose 3 weeks after. I had a sore arm, myalgia, chills, which also lasted about 24 hours. I took the COVID-19 vaccine because I care about our community, I cared about our loved ones, and I care about your loved ones. Please, I played my part. It's time for you to play your part and take the COVID-19 vaccine. Thank you.
My name is Kristen Dharmafal. I'm an orthopedic sports medicine surgeon practicing in Iowa. I have received both of my doses of the Pfizer vaccine for COVID-19. This is my story. Dose 1 was on December 23rd. I had approximately 1 day of muscle soreness at the injection site and no other symptoms. I received dose 2 approximately 2.5 days ago. After the second dose, January 13th, approximately 18 hours later, I did develop some pretty significant muscle soreness, kind of generalized fatigue. It lasted less than 1 day. I was able to complete regular surgeries without any issues. I did not have any sort of fevers or other symptoms like that. I currently have some residual muscle soreness in my deltoid at the injection site, and that is all. This is my story, and this is my contribution to ending this pandemic.
Hey guys, I'm Zareen. I'm one of the pediatric residents here at Georgetown University Hospital. So I just wanted to share my vaccine experience with everybody. So the first shot that I got, that was in late December, close to Christmas. I didn't really have many side effects. I just had a sore arm. I had some muscle ache, some fatigue, but I was also covering the hospital floors for Christmas, so there could be some contribution from there as well. Then my second dose I got about 4 days ago now, and around 12 hours after the dose I woke up in the middle of the night with chills, with a fever and nausea, very bad body aches. My temperature was around 101 at the time. I tried to power through it and not take an Advil, but later on I had to because I really couldn't sleep at all. I continued with these symptoms for at least around 36 to 40 hours, and after that I have been fine, absolutely fine, no symptoms. And through all of this, what I kept telling myself was that this is what when your immune system is revved up and it's making antibodies, doing its job, this is the kind of symptoms that you can expect. And I would just recommend that during this time, just increasing your fluid intake and taking Advil if you need to, or Tylenol, whatever works for you. I think it's fine, but do not take it before you get your shot, because I think that can really hamper your immune response to the vaccine. And all in all, I think I am happy, and I would definitely recommend the vaccine. Please take it. Thank you.
Hi, I'm Ariella. I'm an infectious disease fellow at UCLA. I got the Pfizer vaccine. After the first dose, I had a little bit of arm stiffness, and then after the second dose, I had a day or so of muscle aches and fatigue that resolved with some ibuprofen. I got the vaccine so that I could keep my patients and my family and community safe, and I wouldn't hesitate to get vaccinated again.
Hi, my name is Courtney. I'm an ICU nurse and nurse practitioner student from Grand Rapids, Michigan. I was about 16 weeks pregnant when the pandemic started, and had my son in August and returned to work in an ICU full of COVID patients in mid-November. The vaccine became available to me at the end, December 19th is when I got my first dose, and I got my second January 9th. I was a little apprehensive when I first learned it would become available to me, but after speaking to experts that I trusted and looking into the advice from the CDC, ACOG, other reputable organizations, the risks seemed small to me and the benefits were obvious. So I feel really good about getting the vaccine. I'm breastfeeding now, and I'm hopeful that I may be able to pass on some protection to my son as well. So hoping that everyone who's wanting the vaccine can get it as soon as possible.
Hi, I'm Kelsey. I'm one of the fourth year Med Peds residents here, and I'm talking about my COVID vaccine experience. So I've gotten both doses. The first dose was about 6 weeks ago, and it was pretty unexciting. I just had a little bit of arm soreness, and then I got my second dose about 2 weeks ago, and I had some body aches overnight, and some headache and some chills. But it really only lasted a few hours. I took a dose of ibuprofen and felt pretty well by the next day, and really haven't experienced anything else since that time. I'm really just excited about the future going forward now that we have a vaccine, and I feel like it's a really important step to be able to talk about my vaccine experience with my patients in clinic. Thanks.
My name is Meredith. I am an outpatient rehab technician, so I do have direct patient contact. 37 years old. I've had both of my vaccine shots for COVID-19. The first one was 4 weeks ago today. The second one was last week today. And both of them I had fatigue, arm soreness, a little bit of headache, but I found just hydrating and resting helped with those side effects. There was a little bit more irritation in my lymph area on the arm that I received the shot for the second shot. However, it was bearable. I was able to still go about my daily activities. And I'm very excited to have both shots. I'm looking forward to feeling safer, working with patients, and getting back to my pre-COVID activities, seeing my family and my friends with not being as nervous about it. But I would highly recommend, if your doctors approve it, that you get the vaccine shots.
Hi, my name is Monica. I am a second-year family medicine resident in the Kansas City metro area. I received my Pfizer vaccine on December 17th and the second dose on January 7th. At that time, I was about 22 and 25 weeks pregnant. It was personally an easy decision for me. I didn't really think twice about it. I did review the Society for Maternal Fetal Medicine recommendations as well as ACOG's recommendations, both of which essentially say that pregnant women should be allowed to get that vaccine if that is their personal decision, as we know that the COVID infection can lead to increased morbidity and mortality among pregnant women. My only side effects that I experienced, I had a sore arm for about 24 hours after each of those vaccines. With the second dose of the vaccine, probably about 12 hours after getting vaccinated, I woke up with some chills. I never had a fever, and then I had some body aches and pains the following day, and I took some Tylenol for that. Overall, very low risk, especially compared to what I have seen people with the COVID infection go through. So I would highly recommend that when that vaccine becomes available to you, that you make an educated decision and hopefully choose to get it. Thanks.
Hi, I'm Chris. I'm a physical therapist at Georgetown University Hospital. I've had now 2 doses of the COVID-19 vaccine. I had my first one in December and then my second one a week ago. After my first one, I really didn't have any side effects. After my second, did feel a little bit achy, but I took some Tylenol, my arm was sore, and a week later I'm vaccinated, so I'm very grateful.
Hi, my name is Maureen Hannon. I'm a nurse here at Georgetown. I had my second COVID vaccine today and have done very well from it, but the first vaccine, I had some tightness in my chest and some rapid heart rate. So because I have a history of some allergies to medications, I consulted with my allergist who recommended that I take Zyrtec ahead of time, and I also didn't drink any coffee in the morning, so I've had absolutely no side effects so far from this second vaccine and have tolerated it very well.
Hi guys, my name is Christine. I'm a pediatric resident here in Chicago. I just want to say that I got both doses of the COVID-19 vaccine from Pfizer and side effects are pretty minimal. I got about maybe like 1 day of arm soreness the day after the dose, and that was pretty much it. So whenever this vaccine is available to the public, you should definitely consider getting it.
Hello, my name is Suzanne and I am an anesthesia resident. I received my second dose of Pfizer vaccine on Wednesday, January 20th. I experienced today after some myalgias or muscle aches and a low-grade temperature. Otherwise, I've been doing just fine. In the past, I've had some issues with vaccine reactions, but overall, I did very well. I recommend you get your COVID-19 vaccine.
Hey guys, my name is Eva. I'm currently a third-year pediatric resident at Akron Children's Hospital. I'm super thrilled to share that I received both my Moderna vaccines. I received my first Moderna vaccine on December 25th and received my second vaccine on January 21st. After my first vaccine, I did just have some mild soreness of my arm, lasted only a couple of hours. And after my second vaccine, I did experience just some muscle aches, a little bit of nausea, and then some chills for about 24 hours. These symptoms pretty much resolved within 30 hours after the vaccine, and I'm completely back to baseline since then. I'm super excited and super thrilled about this vaccine. I definitely think that the side effects of getting the vaccine are short-lived compared to the potential duration and the complications of actually getting COVID. So good luck to those who will be getting it, and I'm really excited about this.
Hi, I'm Megan. I am a fourth-year medical student, and I received both of my COVID-19 shots. I received the Pfizer vaccine, and I didn't have any symptoms besides a little bit of arm soreness. But I'm just so fortunate to be immunized against COVID-19 so I can continue to learn in the hospital while still protecting myself my friends, my family, and my patients.
Hi, my name is Rose Mueller, and I am a third-year PM&R resident physician in Cleveland, Ohio. I work in acute rehab as part of my residency training, and I have seen just horrible things post-COVID throughout the last year, ranging from coagulopathies causing strokes, spinal cord infarcts, loss of limb, people who are still requiring oxygen just to take a few steps months after their disease, just really, really horrible complications of COVID. And I also have immunocompromised family members, and so I was very highly motivated to get the vaccine. I had no reservations. I do have a background in medical microbiology, so I'm familiar with mRNA vaccines and kind of how long that they've been in development. And so I signed up to get the Moderna vaccine as soon as I was eligible. I got the first shot about a month ago and the second shot 2 days ago. I'm one of those people that has an allergic reaction to everything, so I was expecting to get a reaction, but my symptoms were pretty mild. After the first shot, I had a very mild rash at the injection site and a sore arm for about 24 hours. And then a few days later, I got kind of a hive at my injection site as kind of a delayed type hypersensitivity reaction, which went away in about 24 hours. After the second shot, which was 2 days ago, my arm was much more sore than the first time. I had a little bit of swelling in my deltoid, and I got another welt, but the day of the vaccine, right over the injection site. It was about twice as big as the first one, and my arm was very, very sore for about 24 hours. It's still sore 48 hours later, but much better. I had no systemic symptoms, though I know people who did get low-grade fever for less than 24 hours. But overall, I am super thrilled to be vaccinated. This is a huge relief for me, and in about 10 days, I will have approximately 95% immunity from the virus, which is extremely, extremely awesome.
Hi everyone, I'm Anima Kimire. I'm a internal medicine resident in Rochester, New York. I recently received the Moderna vaccine. After the first dose, I noticed some injection site soreness, but otherwise very uneventful. After the second dose, I did notice some soreness as well as some just myalgias, but otherwise, again, very uneventful, did not have any chills or fevers, although I know the reactions have been different for different people. I'm just grateful to have gotten the vaccine, and I am so excited for the vaccine to roll out and for other people to receive it as well.
Hi, my name is Gina. I'm a third-year internal medicine resident at the University of New Mexico. I received 2 doses of the Pfizer vaccine. After the first dose, I experienced some body aches and pains, pain at the injection site. Everything resolved within 24 hours. After the second injection, roughly 3 weeks later, I had a little more intense symptoms. Again, I had mild body aches and pains, pain at the injection site, and then I had a low-grade fever. Everything again resolved within 24 hours, and I was able to go on a nice long hike a couple days later without issues. I am very hopeful for this vaccine, and I am excited for my family, friends, and patients to receive it.
My name is Neil Wallace, and I'm an emergency physician at the U of A in Tucson, Arizona, and I got the first dose of the Pfizer vaccine on December 18th and the second dose on January 8th. First dose, I had a little bit of arm soreness, and the second dose, I had a little bit more arm soreness, a little bit more than the flu shot, I would say, but no other side effects, and I'm really excited I'm vaccinated. Now I can protect myself a little bit better against this awful virus.
Hi, my name is Sala. I'm a third-year internal medicine resident at University of New Mexico in Albuquerque. I got the COVID vaccine on the 18th of December, and my first shot was there, only sore arm. The second dose was 3 weeks after, and I had only sore arm, and the next day I had only a little bit of chills, which is similar to the flu shot. I took the vaccine because I do care about my patients. First of all, I want to keep them safe. I don't want to be an asymptomatic carrier. I care about my family, I care about my friends, and about my beloved ones. I encourage everybody to take the vaccine.
Hi, my name's Carla. I'm a resident in Naples, Florida, and I've just completed my second dose of the Moderna vaccine. I had the first dose about 28 days before I took my second dose. At the time, I had some swelling and a lot of pain at the injection site that lasted for about 24 hours and then resolved. Not much different from how I feel when I get the flu shot, to be honest. No fever though, no chills, so I was pretty lucky. And then the second dose, initially I had a little bit of nausea and the same pain at the site. The pain sort of eclipsed the nausea though until around like the 12-hour mark, and then I had just some like dry retching but no actual vomiting. And then I thought I was doing okay, and I started developing some muscle aches and joint pains, and then around 36 hours I started getting chills, had some sweating, but now almost 48 hours out, back to normal health. My arm doesn't even feel sore anymore, so I'm glad I did it, not just for me but so I can see my family and protect all the people around me. I really hope that most people make the decision, or at least more people make the decision to get vaccinated. There's some of us who would do anything to see our family. I haven't seen mine in over a year, so it's very important, not just for me in terms of my work, but also personally.
Hi, I'm Jessica, and I'm an internal medicine resident physician in Southwest Florida, and I am fully vaccinated against COVID. So I made the decision to get the COVID-19 vaccine a little bit over a month ago now. It was not an easy decision for me to make at the time. I had heard a lot of things that I felt were concerning. On top of that, I wasn't sure if this vaccine really had been rushed. I felt like there was a lot of financial incentives for the companies with little financial risk. And so I wanted to be sure that I was really making an educated decision. And so what I did was I spent, and I'm not joking, 8 hours researching the history of mRNA technology. I spent time looking back into the original SARS-CoV and what was done at that point in time. And actually by the end of it, I not only felt very much reassured, but also inspired and excited to have this opportunity. So I got the first dose about, like I said, a month ago, and I just had some arm soreness, maybe a little bit of fatigue, lasting less than a day. With the second dose, however, and I did anticipate that it would be worse because I had heard from some of my friends who had gotten the second dose that it was a much tougher time. But I had about 7 hours after the shot, some chills, followed by muscle aches, joint aches, and low-grade fever, anywhere from 100 to 101. I did wait quite a long time before taking any Tylenol or ibuprofen, but eventually I did give in and I felt much better. And those symptoms lasted for about 36 hours. And then after that, everything went away, and I feel great now. And not even normal, but I feel awesome, and I'm excited. I'm happy that I'm vaccinated, and I'm happy to have done my part.
Hi, my name is Cassie Shaw. I am a hospitalist in internal medicine at the University of New Mexico. I have been caring for COVID patients since the pandemic began in the spring of 2020. And I'm fortunate enough to have been one of the first people to receive my vaccine. I received both doses of the Pfizer vaccine. My first one was in December. The second one was in early January. First initial symptoms were a little bit of soreness. It actually wasn't even as bad as the flu vaccine. The second one, I did have some low-grade fevers, chills, myalgias. Those were gone in about 48 hours. Having paid personal witness to some of the tragedies that come with COVID, both in young, healthy people, older loved ones, matriarchs and patriarchs of families being lost to this terrible disease. I know that my symptoms were nothing compared to what others are facing, have faced, and even continue to face. So I'm so thankful for this vaccine, and I hope that all of you sign up, get yours when you can.
Hi, my name is Lisa. I am a radiology resident in New Mexico. I got the first COVID vaccination shot, the Pfizer vaccine, about 3 weeks ago now. That went very well. After the shot, I experienced a slight headache that lasted for about an hour. I had a little bit of arm pain that lasted for about a day. And then I did experience a little bit of fatigue that lasted for about 3 days, but nothing that kept me from going to work or anything like that. And then about 4 days ago now, I got the second COVID vaccination shot. That went very well as well. After the shot, I did feel pretty crummy from, I would say, about hour 2 to hour 6. I kind of just laid in bed for a couple of hours. I took about a 2-hour nap, which definitely helped. I didn't experience any fevers or chills or muscle aching or anything like that. I did experience a little bit of an increased fatigue as well. That lasted for about 3 days as well. I definitely experienced increased soreness at the injection site with that shot. My arm still hurts about 4 days out now. And the only other kind of random symptom that I've noticed is that I'm having some armpit pain on the side of the injection. But other than that, I am feeling honestly great today, and just excited to have some COVID antibodies.
Hello, my name is Kelly Neal. I'm a third-year otolaryngology and head and neck surgery resident in Joplin, Missouri. I was very excited to get my COVID vaccine, considering all of the work that I do in the nasopharynx. As you might know, this is where the virus primarily does most of its shedding. I had my first dose of Moderna in late December. I actually went in between surgeries. I did not have any complications at that time. The next day I had some mild soreness of my left arm. I had my second dose of Moderna about a month after that, and approximately 13 hours after administration, I did wake from the night with some fevers, chills, and muscle pain. This did continue into the next day. I actually got quite dizzy and lightheaded. The nausea persists, as well as the fever and chills. It did persist all the way into the next night, where I did have worsening of my fevers and chills. I woke up on day 2 feeling about 90% better. The only thing that I was still suffering from was some mild weakness throughout the day. And by day 3, I felt completely back to normal. And I know that this was just a normal response of my body reacting and creating antibodies. And I feel very confident now that when my body does become exposed again to the COVID virus, that I will be well protected.
Hi, my name's Eric. I'm a hospitalist physician at the University of Rochester, and this is my vaccine experience. I've received now 2 doses of the Pfizer COVID-19 vaccine. My first dose on December 16th. My second dose on January 6th. After the first dose, really the only side effects to report were sore arm, minor fatigue. The second dose, I did have more symptoms starting on the day after, and I was quite fatigued and did have some body aches as well. But by the following day, that had all resolved and I felt great. So really, what I would say about the vaccine is that the side effects are mainly evidence of mounting an effective immune response, and they're nothing to shy away from. I would encourage everyone who is eligible for this vaccine to please pursue it at their earliest convenience. And it's really the only thing that's gonna get us back to normal as soon as we can. Thank you and take care.
Hey everybody, Paul Ruggieri here. I'm a former Team USA gymnast and now a nursing student in Syracuse, New York. I also work as a nursing assistant at a local hospital for the time being. I did have COVID in July of 2020. I did get pretty sick from it. I was pretty heavily exposed. I had my first vaccine, Moderna dose number 1, on December 30th, 2020, and the second dose on January 25th, 2021. I did get slightly ill from the first vaccine. I was out, maybe 24 hours, flu-like, but just tired. The second vaccine, however, I thought I was in the clear. After 24 hours, I felt okay, just a little bit tired. But by hour 48, I noticed on my Apple Watch that my heart rate jumped to 106. I'm normally about a 52. I was like, what's happening? I'm sitting in a chair doing nothing in the middle of the night, and my heart rate is 106. I noticed my respiratory rate was super high, in the 30s. I had a headache, really bad headache, sore throat, chills. I was sweating like crazy, on and off. And I was really, really tired. I couldn't think straight. And that kind of lasted for 3 days, and I did spike a fever by day 3. So my temp had elevated, but it hadn't gone over 104 until the 3rd day, and I did go up to 102. So thanks for listening, guys. I hope it helps you prepare for the Moderna dose number 2, if that's what you're getting.
Hi, I'm Avery. I'm a second-year general surgery resident in Michigan, and I had the unique experience of actually getting COVID. So the week that the Pfizer vaccine was being rolled out, I was at home quarantined with COVID. So while all of my co-residents were getting vaccinated, I was unable to do so. So I was really excited leading up to that point at how quickly we were able to get multiple vaccines available to people across the United States, and I was looking forward to getting it myself. So as soon as I had recovered, I went ahead and got the vaccine. The current recommendations are to still get the vaccine even if you've already had COVID. Usually immunity lasts for at least 90 days, but we really don't know at this point how long natural immunity lasts. So at this point, the recommendations are still to get the vaccine, which I've gotten my first one. I had a little bit of arm soreness afterwards and some body aches, but all of that subsided within about 24 to 48 hours. And I'm looking forward to getting my second vaccine just this week. So I encourage you to, really consider doing this. It not only protects yourself, but it protects the people around you, your family, your friends, and it really gives me a peace of mind knowing that I've done everything I can to protect myself as well as those around me. So.
Hi, my name is Kelly, and I'm a pharmacist in Michigan. I got the vaccine for multiple reasons, one of them being that I have 2 small children under 18 who aren't able to get the vaccine, so I thought it was important as an additional layer of protection for me to get it myself. And also as a pharmacist, I will be administering vaccines, and I like to lead by example. So I got the vaccine, so when I advocate and talk to other people about the vaccine, it's important for them to realize that I feel strongly enough about it that I got it myself. Please do your part to help end this pandemic and end the spread of COVID-19. Mask up and get your vaccine.
Hi, my name is Ashley Forbes, and I'm a speech-language pathologist from Michigan. I got my vaccine to protect my clients. My clients have been in quarantine since March, and they have not left for even a grocery trip or to see family members. And they're doing so because they're immune compromised. These are people that are victims of car accidents. This could be anyone. And we need to do our part to help protect those vulnerable populations that are not able to protect themselves. As scientists, it's our responsibility to be a calm voice of reason amid the polarization that's occurring among Americans in politics. Unfortunately, this virus has been used as a political weapon, which is really a shame and a detriment to the American people. I urge you to please speak with each other, speak openly about your experience with the vaccine, and allow yourself to be a person that others can come to for advice, for questions. Be kind, be understanding, because at the end of the day, we all have a common enemy, and that's the virus.
I'm a primary care doctor, and I'm so happy to say I'm fully vaccinated against COVID.
I'm a dentist in Michigan, and I got my vaccine to help eradicate COVID-19.
I'm an advanced practice registered nurse, and I got the COVID vaccine.
I'm a nursing home employee, and I got the vaccine to stop the spread of COVID-19 to our most vulnerable population.
I'm a pediatric psychologist, and I'm also 20 weeks pregnant. I got the Pfizer COVID vaccine to protect myself and my growing family and to help stop the spread.
I got vaccinated to protect my family and hopefully give her the antibodies to protect herself.
I got the vaccine so I can do gymnastics and see my family.
Hi, we're teachers from Michigan, and we got the Moderna vaccine so we can have all of our students in face-to-face instruction soon.
I'm an engineer in Michigan, and I got my Pfizer vaccine to do my part in the battle against COVID.
I'm a clinical social worker, and I got my COVID vaccine.
And I'm a medical resident, and I got my COVID vaccine.
Hello, I am a business analyst currently living with a brain tumor, and I received my Pfizer vaccine.
I'm a middle school teacher in Virginia, and I opted to receive my Pfizer vaccine. I'm greatly looking forward to the day in which 100% of my students can return to in-person learning, and in which I can safely travel to visit my loved ones, most of whom I have not seen since before the pandemic.
I got the vaccine because I want to reopen society.
Hi, I got the vaccine. I'm very happy I did. It did have a few side effects, but it's far more important for me to have gotten it than to have gotten COVID. So get the vaccine.
I got the vaccine, yay! I got my vaccine. I got the vaccine.
I got my vaccine.
I got the vaccine.
I got the vaccine.
Got the vaccine.
I got the vaccine.
We got the COVID vaccine.
I got my vaccine ×2. It's an injection of hope. Can't wait for this to be over.
This was our shot. Now it's your shot.